Imagine being treated for the wrong disorder for years, taking meds that don't work, feeling like nothing is going to help, when really you were just misdiagnosed. And that happens all the time with bipolar disorder and borderline personality disorder. Today, I'm going to clear up the confusion so you don't waste years chasing the wrong diagnosis. Here's the biggest clue that I want to mention. What is triggering the mood swings? In my 25 years as a licensed therapist, I have found that there's a simple question that can help tell the difference. And here it is. Do your shifts in mood and emotions happen randomly? Or do they come from stress or people or life events? Let's look at these mood shifts from the perspective of bipolar disorder. Now, in this situation, mood changes happen in a period of days to weeks, and they come on more randomly. You might have manic episodes of super high energy, impulsivity, and depressive episodes of low energy, sadness. And the thing to remember is that bipolar disorder comes in different types. If your mood shifts include full blown mania, where you feel invincible, you don't need sleep, you make impulsive choices, you maybe just feel super great about yourself all the time, it could be what's called bipolar 1. If your highs are less extreme, and this is called hypomania, and depression is more dominant, it could be bipolar 2. So let's talk about that hypomania for a minute because a lot of people don't recognize it. It may be that you feel just really productive, really energetic, and it's actually a good thing. Why couldn't I be like this all the time? Right? That interspersed, maybe even just once happening with episodes of depression, that goes along with bipolar 2. But I really want to underline that these shifts aren't typically caused by life events. They just kind of happen on their own. So here's another way to think about these diagnoses. Bipolar, you can think about it as a really long roller coaster. We've got a slow climb, a big drop, but it lasts for days or weeks. And often you'll just wake up feeling totally different, and there's no real clear reason why. For BPD, you want to think about it like emotional ping pong. One moment you're fine, and the next something happens and you feel abandoned or empty or angry. And maybe a friend canceled plans or a partner doesn't text back. So it's a reaction to an event often that causes a big emotion. The key difference here is that bipolar is about distinct mood states that last for days, and BPD is about extreme emotional reactions that happen in the moment. Okay, let's take another look between bipolar mood swings, let's do it on this side, and BPD emotional dysregulation. Let's do it on this side. So let's talk about the differences in mood shifts. For bipolar, it's going to be days to weeks. And for BPD, it's going to be minutes to hours to a day. Bipolar side, our main cause is brain chemistry. It cycles on its own. And on the BPD side, triggers by events, relationships, stress. Do we have mania on the bipolar side? Yes, we typically do. High energy, impulsivity, sometimes delusions. On the BPD side, we don't have mania, but there can be some impulsivity and emotional intensity that can sometimes read as manic. On our bipolar side, what's our treatment? Meds, mood stabilizers, and antipsychotics, and therapy, right? On our BPD side, our treatment is therapy, most commonly DBT or CBT, and sometimes meds for co occurring issues like depression, anxiety, things like that. So, this difference in the cause for mood changes is just one key difference between BPD and bipolar, but it's not the whole picture. Remember, mental health diagnoses are complex, and only a trained professional can give you a full assessment. If any of this sounds familiar, talk to your therapist, talk to your psychiatrist, or get a therapist or a psychiatrist who is willing to help you figure out what's really going on. Oh, and here's a question. Can you have both bipolar and BPD? Yes, the National Institute of Health, their estimate is about 10% of folks with bipolar 1 also have BPD, and about 20% of folks with bipolar 2 also meet criteria for BPD. So it's not super likely, but it can happen. Remember, getting the wrong diagnosis can mean getting the wrong type of help, which actually makes it not really help at all sometimes. But now you know what to look for and talk to your mental health professional about. If this video gave you some clarity, hit like or subscribe. It helps more people see it. And drop a comment below. Do you have any questions you'd like answered about borderline personality disorder? I would love to do another video about some of those questions. And if you'd like to learn more about BPD, check out this video. Bye.